Hello, I am Dr. Pramod Bhor, Director of Orthopaedics, Fortis Hospital, Vashi. Today I am going to talk about arthroscopy. So basically, arthroscopy is a minimal invasive surgery. It's a type of minimal invasive surgery where we do not open the joint and use a 3 mm arthroscope, 3.5 mm arthroscope for 30-degree arthroscope, which we insert inside the joint and have a look at the joint. We are able to do the surgeries with using this arthroscope. So any joint can be seen through the arthroscope. Commonest joints that we see is the knee joint as well as the shoulder joint, plus ankle, wrist and hip joint also can be seen through the arthroscope. Many of the ligament surgeries where we do not have to open, earlier we used to open, rather are tackled using an arthroscopic joint. Because of this, we are able to handle ligament injuries far better. So for the knee, if I consider I do an ACL reconstruction or a meniscal repair or a PCL reconstruction or a multi-ligament injury using an arthroscope. Considering the shoulder, recurrent shoulder dislocation where the shoulder gets dislocated again and again, plus rotator cuff repairs where the rotator cuff muscles are torn, or any other loose body, and can be handled using an arthroscope. The most important advantage is that the soft tissue envelope remains there. The blood loss is minimal. There is no blood loss until plus the post-operative fibrosis in case of open surgery is more as compared to when I am doing an arthroscopy. It is definitely less. So it is very minimal invasive. It is only, so I would say the arthroscope needs only about a 5 mm incision to enter the joint, and the instruments go from the other side. The instruments are such that they are also similarly small. With the image that we see on the TV are magnified, and we are able to do it using this thing. So it is a great boon, specifically in patients with any sports injuries. Even sports athletes are normally having smaller injuries. They have a faster recovery using the arthroscopic techniques. The advantage of arthroscopy is minimal invasive, and all the ligaments and all the soft tissue injuries can be treated inside the joint using an arthroscope. Thank you.